Assalamualaikum Pakistan.
FM 100.
Karachi, Lahore, Islamabad, Hyderabad, Rahim Yar Khan, Multan, Abbottabad, Gujarat, Jhelum, across Pakistan. This is FM 100. FM 100.
हैदर से कराची तक आपका हम सफर
रैन न जागे जागे ना रैन न जागे
Visit our website.
Do's and don'ts, and plus its psychological impact as well. We have been very privileged today that we are going live across different pages on mainstream media, on Facebook Live with NZIP page at the moment, and plus we are also going live on FM 100 Pakistan page, and people in Pakistan and across the world can listen to us as well. I will request everyone to stay with us, and if you've got any questions, please send us through those questions on NSIP Victoria Facebook page, and also you can send us your questions on FM 100 Pakistan's Facebook page as well. We will start off with formal proceedings of today's session, and first of all, I would like to ask our president or NZIP, Dr. Aisha, who is a fellow of Australian College of Physicians, FRACP medical oncologist, senior staff specialist, senior lecturer, Melbourne University, Epworth campus, and she is the president of NZIP Victoria, and I'd like to welcome her to the stream. Dr. Aisha, Assalamu alaikum.
Assalamu alaikum. Thank you so much, Dr. Irfan, for your nice introduction. And hello, everyone. Assalamu alaikum. Ramadan Mubarak. Thank you for allocating time to be involved and come to our presentation today. COVID-19 is a difficult time for everyone. And I'm really grateful for you allocating time to know a bit more about this unknown virus. Again, COVID-19, it has changed. It's a life changer for everyone. First case we have had in Australia was on 25th of January while we were trying to cope with the bushfire. 11th of March, WHO declared pandemic. 20th of March, the borders were closed for non-residents. 21st of March, we were all locked down with the social distancing. It has impacted everyone at every level, and it's hard to cope with what's coming next. And the issue has been not knowing much about this virus and the impact it has caused or may cause in a long term. This outbreak has impacted many people at many levels. It is understandable that during times like this, people may be feeling depressed, worried, anxious, and overwhelmed by the constantly changing alerts and information. And thanks to NZEP recognizing the need and coming up with this excellent program with the expert panel, and welcome on board to our expert panel. Looking forward to see your input as well as question answer session. Hopefully they be able to answer most of your question, if not all. Looking forward to it. I won't take any longer time. I would take it back to Dr. Irfan Malik, who is our NZEP Vice President as well. Before I go, I just want to ensure everyone as a community that you guys are doing really well. Hang in there. We are in it together and we be out together. All the best.
Thank you very much, Dr. Aisha. I'll just add Dr. Shehroz Khan as well, who is General Secretary of NSIP Victoria. And for viewers, आपको हम बताते चलें कि this live stream is going live from Melbourne, Australia, and it's being viewed across the world through different channels. FM100 Pakistan is putting us live as well, and we are very thankful to the team of FM100 Pakistan for taking us live as well. Dr. Shehroz, welcome. Assalamu alaikum.
Walaikum assalam, Dr. Irfan, Dr. Aisha, assalamu alaikum, everyone.
Please.
So I'm Dr. Shehroz. I'm a general practitioner here in Melbourne. And of course, we never thought we would be going through something like this. We are doing a lot of telehealth. We never thought we would actually prescribe patient stuff and examine people over the phone. This has totally changed medicine in Australia. And I'm sure other countries are also following this. I don't know. I'm sure everyone has read about COVID-19 and they know the symptoms, which are like normal flu-like symptoms. They mainly affect the elderly and immunocompromised people. And we have our expert panel here, and I'm sure we're going to enjoy this discussion with them.
All right. Thank you very much, Dr. Aisha. Thank you very much, Dr. Shehroz, for joining us here. And I'm positive that this is going to be a really informative session. Thank you very much. I really appreciate your time.
Thank you.
All right, people, we'll start off the formal proceeding of the session now. And just like I'll keep it in Urdu and English because there's a lot of people who are listening to us in Pakistan as well through different channels. So I'll start off with our panel of guests. The first guest that I have is Dr. Yusuf Haroon Ahmed. He is a general practitioner and medical educationist, and he's chair board of directors, Rural Workforce Agency Victoria, counselor, RACGP Victoria, and chairman COVID-19 pandemic lead group, Central Gippsland All Health Services and GP practices. He's chair United Leaders Forum and Australian Association of Pakistani Professionals, and is member of NSIP. I would like to welcome Dr. Yusuf Haroon Ahmed. Assalamu alaikum, Dr.
Assalamu alaikum.
Hi, कैसे हैं आप? And Dr. Yusuf, आपको आवाज आ रही है? You can hear me?
Yes, I can hear you.
Yeah, perfect. So that's great. Now, next we have our next because we have three guests, and Dr. Yusuf is a general practitioner. Now we have the next guest is Dr. Sabah Khalid. She's a qualified consultant psychiatrician with specialist qualifications from Royal Australian and New Zealand College of Psychiatrists in both general and psychiatry and geriatric medicine. 20 years clinical experience working in Australia with specialty interest in presentation and treatment of psychiatric disorders in later life and diagnosis and treatment of early onset dementia. And I'd like to welcome Dr. Sabah Khalid. Assalamu alaikum.
Assalamu alaikum, Dr. Irfan. Assalamu alaikum, everyone.
Thank you very much. And our third guest for today is Dr. Bashir Gondal. Dr. Bashir Gondal is consultant emergency physician at Monash Health since 2005, in Australia since 1998. Prior to training and career in emergency medicine in Australia, he was in UK where he completed surgical training FRACS and worked there for 5 years. He's ex-president of NSIP and passionate to help international medical graduates to get into workforce in Australia. I would like to welcome Dr. Bashir Gondal.
Thank you.
We'll start off with Dr. Yusuf first. We will be taking listeners. We will be taking comments from you. We'll be taking questions. अगर आपके कोई भी सवाल है COVID-19 कोरोना वायरस के हवाले से तो आप हमें मैसेज कर सकते हैं FM100 पाकिस्तान के पेज के ऊपर और NSIP के पेज के ऊपर. Those messages are coming straight to us. Other messages can be diverted through those channels because we are going live through there. So I'll start off with Dr. Yusuf. If you can kindly share with us the current numbers, what's happening, what's the status of everything going on at the moment, and then we'll take it on from from there, and we'll start off question answer session भी हम करेंगे. और आप लोगों को भी अगर कोई सवाल है तो please send us your questions. And as I said, this conversation is going live across the world at the moment. So Dr. Yusuf is going to show you some slides as well. I'm just waiting for the slides to come up. And as soon as they are there, we will take it on from there. In the meanwhile, Dr. Yusuf is mainly going to talk about the cases which are happening here in Australia and what is the trend and what is the current scenario in Australia. So I'm just waiting for just.
Assalamu alaikum everyone again, and
yes,
while Irfan is setting up the share screen, I just take this opportunity to say thank you to NZEP for organizing this, I suppose, very timely forum for all of us, the doctors as well as the community. So in next 10 minutes, I'm just going to talk about COVID-19, where we are and what the future holds. And by end of this session, I will also be providing you some useful resources which may be helpful for your own use, and so please stay tuned. This is something which all Australians are quite used to seeing every day on the main media. This is basically the infographics of the COVID cases in Australia, and I'm just going to really highlight 2 or 3 things. It's a very busy infographics, and we see that over this period of time we see this a big pyramid of cases in Australia. But if we really look at these numbers and analyze them further, we will realize that most of the cases which are actually transmitted within Australia actually pretty much stays the same near the baseline. Most of this excessive number of cases actually came from overseas, either through cruise ships or from other countries, or people who actually directly got positive results because of direct contact with people coming from overseas. So for many reasons, Australia has been lucky that our transmission rate actually has stayed very much close to the baseline for the last 6 or 8 weeks. Another important aspect I would just want to highlight about the transmission or the cases by age group and sex. I think this is quite common understanding that the COVID-19 is a deadly disease for elderly. But the fact is that the most people who actually carry this virus are actually young ones. So if you look at this graph in Australia, it's between the 20 to 39 years of age which actually carry most of the infections. While actually the people who are in the older age group, very few of them actually transmit the infection. But if you move to the graph 1 step down, which is more about the deaths caused by the coronavirus, situation is completely different, where most of the deaths have happened in a very elderly group, while the young one are actually spared with any serious impact on their life. So the message which I really want to transmit here, that, or to tell the community, that it's the young people as well as elderly, it's everybody's responsibility to ensure that they continue the precautions, don't transmit the disease, because unfortunately it's your grandparents, it's the elderly people who actually affected because of the transmission of COVID virus. So let's talk about the health response in Australia, and I think most of you are nearly specialists in this field by now, by listening to the media. So as Aisha mentioned, that somewhere around 10th of March or 11th of March, when the pandemic was announced, Australia created a bubble around itself by restricting the travel. Other than a bit of saga with the, the Ruby Princess cruise, I think we managed to restrict the travel very well. The second part of the response was isolating people with the virus and their contacts. And as you know, there was a legislative requirement. If anybody was positive, they had to stay at home and stay in quarantine. In my own experience here, even regional areas, when people were actually not following the instructions, we involved the local law enforcement agencies to ensure that people actually do follow what they are told. And overall, people did very well. We have already talked about social distancing. Sharoz has mentioned about it, and everybody knows what it means. But this all was actually done for one particular reason, which is growing the health system capacity. When the pandemic hit our shores, of course, no one in the world was prepared for it. Australia, despite having a first world health system, did not have the capacity to manage the cases, did not have the capacity at the primary contact basis to manage a sudden increase in number of cases. So hence, through travel restriction, isolation, and social distancing, we managed to buy some time to actually create capacity within the health system, which we have now done so. But moving forward, the strategy is really 4 prongs, which one I mentioned already, to develop the infrastructure and capacity building. And just to explain a little bit more, initially you would have heard about the fever clinics being set up in the hospitals. They were equally funded by the Commonwealth government and the state government to provide immediate support to practices as well as to community where they can be tested. But meanwhile, the Commonwealth government has funded about 100 GP-led respiratory clinics all over Australia. And the reason for that is that to build the capacity within the communities across Australia where they can have immediate testing if there's a new finding of clusters or new cases coming up. And that capacity is now nearly ready, and therefore you are seeing the benefits of that capacity by the announcement by the Prime Minister this morning. Second thing is the live data and monitoring. Unfortunately, I had some other slides to show, but for some reason the link's not working. So the live data and monitoring is more about how you can actually see how many cases are around in your area, in your own district, in your own locality. And you can actually, through an interactive map, see how many cases have been diagnosed, let's say in Dandenong area, in Melbourne, and how many cases are still live in that area. So the resources we will provide through the NZAP page later on will be able to give you that capacity to keep monitoring what's happening in your own locality, in your own location. And the third thing is the rapid response and cluster identification. And this is, I think everybody knows about it now, the tracing app. That has been very helpful in actually developing capacity to locate any clusters and then trace people who may be positive, as well as the contacts they may have. As far as the contact tracing is going on, this has been going on for many years, hundreds of years. We have done it as humans for a long time. But now with the use of digital technology and other methods, we can augment those efforts by the human through these apps. And the good news is that a vast majority of Australians have actually downloaded the app, and it's actually going to produce the results we need. And this all 3 measures are now leading us towards graded relaxation and restrictions. As I mentioned earlier, the Prime Minister has already highlighted some of the restrictions being released very soon. Victoria is hopefully going to follow sometime next week. Following the results from the Blitz are obvious. And when I'm talking about the Blitz, just for other audience in the world, so Victoria decided to find out how many total number of cases we may have in different clusters. So did a sampling by testing about 100,000 people across Victoria. I think this is an important question in everybody's mind, what the future looks like. So if you think I have the answer, then of course you're wrong. But I'm going to just provide you some of the facts which may give you some ideas that how and what the future may look like for all of us. This is a new terminology, which is the new normal. What new normal look like? I think this is a fact, and all of the health professionals already know about it. There has been a rapid digital take-up, like telehealth, education, and business. And that won't be pushed back after the COVID-19 is gone. So this digital revolution is going to stay here with us, and hence that has changed the way we practice, the way we actually offer healthcare to our communities. Second thing is self-sufficiency for Australia and within Australia. The need for key areas to be self-sufficient, and health is one of them. I think we can't outsource business or services which can collapse at time of emergency. I think we have already found that out in the hard way, that when the pandemic hit, how we ended up with a lot of supply issues as well. And that's the third thing, which is the over-reliance on global supply chains. Most of our things, essential items, including the word PPE, which everybody knows about it, being imported from overseas countries. When the pandemic hit us, the international trade was seized, and hence we were significantly compromised with regard to the global supply chain. We were lucky, as I said earlier, that we were lucky that we did not had a lot of transmission of cases, so we got away, and now we are in a position where we have now sufficient supply chain. We have sufficient supply of locally produced PPEs as well, and it's actually working very well. But there are some policy implications as well, and you may have heard from politicians, and we are hearing at higher level through the treasurer. And I was in a meeting yesterday with the Rural Health Commissioner, and they're talking about the workforce and immigration applications as well. Because by relying more on within ourselves in Australia, that will have some implications. There will be some positive and negative implications on workforce or the type of workforce which Australia may need in future, as well as immigration. It may not be the number, it's more about what sort of immigration will be useful for Australia moving forward. So thank you, Irfan. I think I'll stop at this stage and happy to answer some question later on.
Thank you very much, Dr. Yusuf. That was a really informative presentation. जिसमें हमें काफ़ी आइडिया हुआ कि कोविड-19 जो कोरोना वायरस है इसका जो क्या नंबर्स हैं ऑस्ट्रेलिया में. आपको मैं साथ साथ अपडेट भी करता जाऊँ कि इस वक्त जो लेटेस्ट नंबर्स हैं वो confirmed 6,819 cases presently confirmed cases in Australia. Out of them, 6,031 cases have been recovered, and about there are 97 deaths in Australia because of the COVID-19. Because we're covering Pakistan as well, Pakistan has unfortunately risen quite a bit. It is 25,837 cases in Pakistan. Out of those, 7,530 have recovered, and there is 594 deaths in Pakistan. Worldwide, it's 3.85 million at present. 1.28 million have recovered, and 270K deaths are there in across the world. So it is, जैसे डॉक्टर यूसुफ ने कहा कि it is a new normal. जैसे हम जिंदगी गुजारते रहे अभी तक, it's going to change all around, and we are going to be really living in a different world, in a different way. So starting off, जैसे कि हमने different अपने जो presenters हैं उनको हमने choose किया है. डॉक्टर यूसुफ का ताल्लुक जो general practitioner से है. डॉक्टर बशीर कुंदल is an ED consultant, and Dr. Sabah Khalid is a psychiatrist. So हम उनका point of view लेंगे. Starting off with Dr. Bashir, if you can tell us, being a frontline service provider, what is your opinion about COVID-19? How it has impacted your life and your professional life and your personal life?
Thanks, Irfan, for giving me this opportunity to talk about this condition. COVID-19 is actually, I wouldn't call it as a disease. Like, you know, in the past, we used to think like appendicitis is a disease, or maybe the cholecystitis is a disease. This is actually a phenomena which actually has involved the whole planet. And can you imagine, no one knew actually in December, no one knew the name actually, coronavirus. I mean, we knew coronavirus, but this kind of coronavirus, COVID-19, no one knew that. Within 3-4 months, it has from one part of the planet to the other end, almost every country is involved. So talking about my own specialty, us being being on the front line, initially, it was, we were not really prepared. In fact, nobody was prepared. But being in Australia, we were lucky enough, actually, that there were not many people who came here. And those who came, and we managed to sort of get ourselves trained. And it's just looking at my own department, the way we actually responded, we sort of relearned those things which we never had before, like dividing the department into two areas, like hot and cold. And hot area which is potentially patients, those who are kind of positive with COVID. And the doctors, we were divided as well, that these people, they actually meant to work in that area. Can you imagine that working for 9 hours in that area with all those PPEs having on for hours and hours? It is still very uncomfortable. It was uncomfortable. And what I noticed is actually it has taken a massive toll on the staff. I mean, initially we were, I wouldn't call excited, but we were looking forward, like enthusiastic to look forward to look after the patient. But as sort of it's nearly 6 weeks now, and you're doing every day the same thing. You go to work and you change your clothes, go change your shoes and put on your mask, and you're depending on which area you're working, and every medical staff from cleaner to the nurses to all the health profession, they are kind of exhausted now. And even looking at our own, like socially, it is like not being able to see your friends. But I won't actually sort of cross to sort of suburb area. But what I've noticed is actually for the last 2 weeks, lots of mental health patients are coming as well. And people, those who are kind of never able to, or they never were sort of living in the same house, but they were not spending that much time together. They actually people can't get on well. And honestly, I have seen actually, the other day I saw a patient who actually son hit his mother and who shattered her skull. And I mean, that's one example. And so on. And there are so many other issues, mental health, physical. It has actually impacted socially, economically, from every point of view. As I said, it's and one thing I would say before I finish, that's lots of people actually say that they are kind of in denial, which I would really stress hard that is similar to global warming. There's still people those who don't believe there's a global warming. And same is with the COVID as well. Like lots of people think कि कोरोना कुछ नहीं है, ये एवं ही है, कुछ इसका एवं लोगों ने बनाया हुआ है. ये, I think that's so wrong actually. When you know that your friend, your loved one, and in front of you they are actually suffering, and lots of them they lost their fight. It's I would say that's we got to actually be and prepared and for a long run, as Yusuf said.
Yeah, thank you very much, Dr. Bashir. Now, I will move to Dr. Sabah Khalid to get a psychiatrist's perspective about COVID-19, what she thinks, how things have changed in her perspective as a personal life and as a psychiatrist. और साथ में मैं कोशिश ये करूँगा कि we should try to speak in English and Urdu as well. It's a mix so that all audience can be catered for. Yes, Dr. Sabah, please.
Assalamualaikum again, Dr. Irfan. आपने उर्दू वाले सेगमेंट में मुझे आगे कर दिया है.
नहीं, you can stay in English. It's just that's absolutely fine. Whatever you're comfortable with. We want to make sure you are comfortable.
हमारी पहली जबान है, हमारी पहचान है, लेकिन बस बहुत अरसे से परदेसी बन गए हम सारे. हुआ ये.
बिल्कुल.
Dr. Yusuf and Dr. Bashir have made my job easy, really. We are living in unprecedented times. There's absolutely no doubt about it. We're going through an event that occurs 1 in 100 years. Just think about it. Not just us, but the generation above us, which is our elderly patients, our parents, our grandparents, and then even more importantly, the younger generations. We're all going through something where mortality has just become very imminent. True. I'll focus on my patients first, because patients always come first, but then I will take a little bit of time talking about the mental health of our medical colleagues as well. We all know psychiatric patients, जो मरीज जिनको mental illness होती है, they're highly vulnerable. They don't have stable home environments. They don't have good interpersonal relationships. They're fragile. They don't have the resources that a lot of us have. Bashir Bhai ne social baat ki. In psychiatry, it's very interesting. We have taken a little twist on the term social distancing.
Distancing, yes.
We talk about physical distancing and social connectedness. So it's all about keeping apart, but being together emotionally and being together spiritually. Ironically, all जो हमारे ये public health measures हैं, जो दुनिया भर में बहुत similar हैं, हमने एक दूसरे से दूर रहना है, हमने हाइजीन का ख्याल रखना है, हम घर से बाहर नहीं निकल सकते. These have been very counterproductive, or these are very hostile measures for mental health patients who, mental health is all about nurturing trust, nurturing communication. In Victoria, within Melbourne, I can only speak of Melbourne because I've only worked in Melbourne. We work hard to create environments that are very low stimulus, that are very nurturing. We spend a lot of time one-on-one with our patients, and suddenly it's all been taken away from us. These patients, often don't have access to physical health. Our mental health patients, unfortunately, often have poor lifestyles. They don't have regular exercise regimes. They often abuse drugs. They often smoke. They often, in Western countries, also use excess alcohol. And all of these problems have just exacerbated underlying significant mental health concerns. I'll just give you a few examples from what is happening around us. Dr. Yusuf ne baat ki personal protective equipment ki. All of this, protective equipment, mask pehna, gloves pehna, patients who have paranoia or patients who suffer from psychosis, this has been like fuel to their fire. They live in a world where they can't trust, they can't connect, and suddenly their world is invaded by people not touching them, people wearing goggles, people wearing gloves. We have to do very similar to, although Dr. Bashir is, mashallah, a frontline worker. I'm not a frontline worker, I'm a psychiatrist. But working in hospitals, we are also wearing scrubs. We are wearing gloves. We are not going close to our patients. So it's very counterintuitive. This fear of germs, having to wash our hands again and again, being very careful about hygiene, patients who suffer from anxiety disorders, patients who suffer from obsessive compulsive disorders, or rather they're obsessive, they have it's just been skyrocketing. मैं पिछले 20 साल से I have seen so many patients with OCD जिनके हाथ जख्मी हो जाते हैं. They wash their hands 100 times. उनको हम क्या बोले, हमारे अपने हाथ जख्मी हैं आजकल. I mean, I've got hands that are bruised and my skin is dry because, we wash our hands 100 times a day. So it's been a game changer for our patients. Similarly, coming more to our workers. And, in Victoria and Australia, when we talk about healthcare workers, we are talking about our cleaners, we're talking about our admin staff, we're talking about obviously our doctors, our nurses, our allied health staff. There is so much more depression, so much more anxiety. As Dr. Bashir said, there's a monotony to life. You come to work, you maintain a social distance, you put on your scrubs, you live in anxiety. And if I can say so, if I can address the elephant in the room, us doctors are as anxious as everybody else. There is uncertainty, and I think we need to own it, and I think we need to address this elephant. And I actually also believe we need to share this anxiety with our patients, because anxiety is an amazing phenomena. I love anxiety, and the reason why I love anxiety is every human, from a young child to an elderly person, you don't have to suffer from a mental health issue. You don't have to suffer from a severe psychiatric illness to understand anxiety, to understand fear. And suddenly we are all united. So we need to use this anxiety as a common bond now more so than ever. I think I'll stop here, Dr. Irfan.
Okay, now that was great. It was just the way we were talking, or jaise baat ho rahi hai. I'll try to include some Urdu as well so that we can engage maximum audience. जो एक बड़ी सी quotation मैंने उस दिन पढ़ी COVID-19 के बारे में, and I'll just read that out to everyone. And it was quite interesting. Okay, when it is about COVID-19, when this is over, let's remember that it wasn't the CEOs or billionaires who saved us. It was the janitors, nurses, doctors, cops, and other hard workers who were the frontline workers with us, who have made the difference in our life and who have changed it upside down. And we salute to our doctors. And there were a few comments which I showed during the conversation of Dr. Sabah as well, which we are getting on our ANZA page and FM Pakistan page as well. And I would appreciate if you can send us your questions as well. That would be great, so that we can answer those questions as well. Coming back to you, Dr. Yusuf, how life has changed as a GP. What anxiety do you feel in patients? Has anything changed in your practice as such because of the COVID-19?
Thank you, Irfan. I think Sabah and Bashir has already, I think, captured a lot of the change at individual level as well as at the practice level we are going through.
Yep.
The general practice has completely changed. As I mentioned earlier, that because of the digital revolution, now about 99% of practices are offering telehealth consultations. Before 10th of March, they were probably less than 1% who were doing telehealth directly to patients. But it's important to remember that despite this huge change, they're still offering face-to-face consultations as well. And I think the important message I really want to give to the health professional, but more importantly to our community, is that general practices are safe environment to seek health care. Do not defer your chronic disease management. Do not delay if you are suffering from a mental health illness. Do not take time to seek help. If you are on any medication, come to your GP, come to your psychiatrist, go to your psychologist, seek help. I think, as I mentioned earlier about the capacity building in Australia, the important thing we have emphasized is to provide safe spaces. When we talk about these 100 respiratory clinics in all over Australia, and I'm sitting in one of them right now, these are safe places to ensure that people who have COVID-19 are actually assessed in these safe spaces while the other practices are safe from that stream of patients. Hence, community can easily access services they need. So I think that's important for the community to ensure that they reconnect with their GPs and reconnect with their primary healthcare providers.
No, that's great. Yes, please continue.
To Saba's important message regarding seeking help for mental health. And I think the message from RSCGP is very clear. There is no shame in reaching out and seeking help if you have concern about your mental health. Obviously, there are stresses and the risk of your own health, but above else, the care and concern of your patients, and be taking all that responsibility. And I'm just going to mention that next week, there is a very useful app being released called 10, which is the Essential Network, specifically created for health professionals to manage their life and work balance through COVID-19. So look out for it. Back to Irfan.
Yes, thank you very much, Dr. Yusuf. Dr. Bashir, now we are going to talk about do's and don'ts about COVID-19, and there are a lot of myths around COVID-19. But usse ki taraf jaane se pehle, I would like to, because of ED consultant, because a lot of patients jo coronavirus se affect hote hain, they land up in ED. And give us a bit of a perspective that once they land up in ED, obviously, what is the process and what are the scenarios they go through, and what is the recovery time usually they can get out of ED, just for our general public as well?
As I sort of said briefly earlier, that because in fact, as Brother Yusuf said, that we have got lots of fever clinic or corona clinic around. तो हमारा ऐसे है कि ED के front पे ही we have got a nurse, those who are just checking people's temperature. Those who got a fever and they're not too unwell, they actually are diverted to those corona fever clinics. And coming to those who come to emergency, as I said earlier, हमने emergency को दो हिस्सों में divide किया. एक है potentially there could be corona positive. The other is like somebody come with abdominal pain, sort of headache and all those things. So, for example, if somebody we thinking is coming with a corona positive, तो उनकी entry अलग है, उनकी जो ambulance वाले देखते हैं, they actually already in a PPE level 3, and they are patients are treated in a negatively pressure rooms, and all of us, those who actually look after them, we wear PPE level 3 gearings. It is, as I said, is quite uncomfortable. But what happens is that not that everybody needs intubation. Actually, everybody needs to go to in that room. Like the lots of patients, they actually come and we get the history examination as we do, making sure that all of us we have the protective gearings on. And if we think that they are, what we do is we do the COVID swab test. And if they're well enough, what we do is we just tell them, look, potentially, yes, you can, but you can go home. You're not that unwell. Then make sure you keep yourself isolated until you hear from the Department of Health or Human Services whether you are positive or negative. So once they are negative, they just follow the social distance what everybody else is doing it. Other than that, they stay home. And considering in Melbourne, actually, our area, is one of the area like Casey and Cardinia, southeast part of Melbourne, where actually have the maximum patients, those who are COVID positive. They are being treated at home. Not mean treated, mean they're staying in isolation. So those people, I have actually received so many calls from them, like husband and wife, they came from overseas, both of them positive. And wife said to me, oh, my husband is really getting very sick and he's having trouble breathing. So I said, look, just call the ambulance. And that's how it is actually when they get sicker and sicker at home, and we just look after them. And then if they need intubation, that's another it's quite complex way, which we have been going over and over. And then they go to intensive care units. And then from there on, obviously, we all know what happens.
Generally, recovery time जो है coronavirus का just in I know it varies from individual to individual, and plus their immune response and everything. There are a lot of factors that come into consideration when we talk about recovery time. But generally, just a short answer. What do you reckon once anyone unfortunately lands up in a intensive care unit? How long does it take for them to recover back?
Usually, 5 or 6 days is the one when they start getting sicker, and that's when in a week time, you usually end up that you're going to require a respiratory support like ventilation. And then a week time is actually roughly, I mean, it's not really 100%, it still could be give and take. And people usually stay intubated for a week or so. And then if the situation is going to go in the wrong way, then you, but most of the people in a week time, you get extubated and most likely you will make it.
Definitely. Thank you very much. That's the number I was looking for. Okay, how long does it take? Dr. Sabha, coming back to you, because obviously Corona is one thing, and unfortunately, जो लोग उससे affect होते हैं, that is obviously physical and mental as well. So mental health, obviously, काफी लोग जो है वो कोरोना से तो affect नहीं होते, मगर हर कोई as a community get affected by the mental impact or psychological impact of corona, and across the board everyone is affected with it. How do we move forward from this pandemic towards a better mental health, and for us to shape a new generation now? What do you see? What are your tips for that? Okay, how will there be a normal again?
In psychiatry, we always say, what is normal? Normal is only what your perspective is. There is no normal. And कहते हैं ना, the silver lining on a cloud. Everybody is suddenly focused on mental health as they need to be. And those of us who do work in mental health, be it psychiatrists or mental health clinicians, we are also using this opportunity to advocate and make people realize. Just going to our medical colleagues who are listening in today, Pakistan mein, bahir, hamare Australia ke andar, hamare GPs pe, I mean, salute to our GPs and our frontline workers, you know. They are there out on the front line battlefield. They don't know the person walking in. Abhi to Australia mein systems bade achhe ho gaye. As Dr. Yusuf said or Dr. Bashir ne bhi bola tha, initially we didn't know what was happening. So I would say, focusing on all our medical colleagues जो सुन रहे हैं, मैं आपको airlines की analogy दूंगी. Put your own oxygen mask on first. That is very, very important. Corona ने जो risks create किए हैं, वो ironically सारे mental health के risks हैं. There is a lot of evidence to support that social isolation is actually considered a killer in mental health. Social isolation is a potential killer. And here, what do we have to do to save ourselves from this virus? We have to isolate socially. इसी तरह हमें पता है कि हम सबको कह रहे हैं घरों में बैठें, चाहे वो डॉक्टर हो, चाहे वो जनरल पब्लिक हो. Everybody's home is not a haven. Unfortunately, हम सबका घर हमारे लिए एक safe जगह नहीं है. ये मैं particularly पाकिस्तान पे focus करते हुए कहूँगी, हमारे यहाँ बहुत domestic abuse होता है, बहुत domestic violence है. हमें पता है कि जो लोग mental health के शिकार होते हैं, या even now where everyone's mental health is impacted, Australia में, Victoria में बहुत clear figures हैं. Domestic violence has gone skyrocketing in the last few weeks. हम अपने mental health systems में अपने family support workers को ज़्यादा employ कर रहे हैं, उधर resources डाल रहे हैं. हमें पता है कि financial stress is one of the biggest stresses anyone can face. इस वक्त सारी communities में एक financial stress है. Even, you know, within doctor groups, हमारा एक general है कि doctors are usually financially comfortable. I know a lot of specialists as well as GPs who have been quite impacted financially, not to even mention the hundreds and thousands of businesses and workers who have been impacted, loss of employment. So, you know, we have to stress on how huge this is for us, Dr. Irfan. But like everything else, you know, where do we go? What is the way forward? What is the light at the end of this tunnel? Out of adversity comes opportunity. And where we have a unique opportunity right now, we have to, as you asked me a few minutes ago, what we have to find a new normal. We have to find a new balance, and we have to mold. We have the privilege now as medical professionals, as a community, as caregivers, as homemakers. We suddenly have this unique opportunity to turn this adversity into opportunity by first of all looking after our own mental health, making sure we are okay. If we are not okay, Dr. Irfan has put down some numbers. These are obviously local for Australia, but we would advise कि जो हमारे listeners पाकिस्तान से सुन रहे हैं, other countries, go get help. इसमें कोई शर्म की बात नहीं है. This has been a great equalizer. You know, no one is spared. We have seen prominent political figures get the COVID. We have seen royalty get the COVID. And we have seen poor people get it. We have seen professionals get it. It has been like my anxiety theory. The COVID has also been a beautiful equalizer. And we are so in this together. And we need to bind together now to focus on our children. It's amazing. I'm sure as parents, as professionals, we have seen suddenly, you know, I speak as a parent to 2 teenage boys, you know, there's no sports, there is no music, there is only homeschooling, and there is no Uber Eats, there's only mom's cooking. You know? God help them. Suddenly, हमारे बच्चों की जो हमारी ये जो छोटी generations हैं, इनकी जिंदगी से stimulation निकल गया है. Can't we use this to our advantage? Can't we create and nurture a new generation that is emotionally more stable? We talk about mentalization in psychiatry. I'm going to bore you all for a few seconds because mentalization is very important. It's a fancy term for being aware of your own emotional state, to be in sync with your own emotional state, to be able to sit in silence and not be anxious, to not always need validation. आपको हर वक्त दोस्तों की वो क्या कहते हैं, दोस्तों की थपकी नहीं चाहिए होती है. हर वक्त you don't need your friends cheering you on. You don't need selfies you don't need 100 selfies a day. You don't need to have 2 fancy parties to go to every week. Find peace and excitement within yourself. And once we teach our children to be emotionally stable, to be emotionally strong, to not need anything to entertain, ironically, ये जो बच्चे हैं, ये sensitive हो जाएंगे दूसरों की emotional state से. हमने सब ने देखा है मीडिया में, ऑस्ट्रेलिया में, पाकिस्तान में, अमेरिका में कितने acts of kindness generate हुए हैं. You know, so I know one thing, Dr. Irfan, and I know this as a parent, and I know this as a psychiatrist. The world that we know will not exist any longer. Whether we accept it or not, these younger generations will never be able to look at someone and hug someone or shake someone's hand without worrying about infection. We have changed them. And we need to accept that, and we need to now nurture that. We need to change this into a strength rather than a weakness. We don't want these children to have chips in their armor. We want कि ये जो social isolation है, ये इनकी strength बन जाए. It's not impossible. I actually feel cautiously excited. The one last thing I will say, which is very pertinent to mental health, जो Dr. Yusuf ने बोला, Dr. Bashir ने बोला, हम ऑस्ट्रेलिया में एक रेस एक्सपेक्ट कर रहे थे. हमारे पास रिसोर्सेज नहीं थे. हमने अपने आप को बड़ी जल्दी इक्विप किया. We don't have a race here. We have a marathon. So we in mental health have accepted after this pandemic starts dying down, inshallah, it will, everything comes to an end, we are going to be looking at a mental health pandemic, and we are treating it as a marathon where we need endurance, where we need sustainability. And that's what I ask from our doctors listening in today and our viewers who are not doctors, here for a marathon, not a race. Thank you,
Okay,
Dr.
that's great, Dr. Sabha. We are getting a lot of questions as well, and we will try to cover as much as we can. Obviously, we'll not be able to cover all the questions that we are getting at the moment, but I'll quickly go through those questions, and then we will take our messages from our panel as well. Just a question is that how Dr. Yusuf and Dr. Bashir see today's announcement of easing down lockdowns in step-by process where there are still 20 plus cases. I've just got this question from Shehzad Ahmed, and that's the question he has. I would give it the opportunity to Dr. Yusuf and Dr. Bashir to answer that question. It's on your screens at the moment.
Yeah, thank you for that. And thank you, Shehzad. I think, as I mentioned earlier, that we had this last 7-8 weeks to develop the capacity we needed to respond to the pandemic. If we were hit the way USA or UK were hit in their initial days, our story would have been the same like Europe and USA. We are lucky for many other reasons. But now we do have the capacity, we do have the structure, we do have the appropriate mechanisms to not only identify the clusters rapidly, as well as isolate and manage those clusters. So I think there is a slow transition toward some sort of relaxation. As Sabha has already mentioned, it's never going to be the same normal ever again. And I know it seems to be a very serious and significant statement, but it's going to be a positive statement for future.
Definitely. Dr. Bashir, would you like, there's another question which I'll put you to Dr. Bashir. There's another question that in UK, testing of COVID-19 vaccine has started. What about in Australia? Akil Shah is asking that question. So Dr. Bashir, if you like to take that on, what would you say about that?
Well, personally, I really don't know at this stage whether we got anything like a vaccine against COVID-19 in Australia. And I don't know whether there might be some various things being tried and tested overseas, but I'm not really aware if there's anything, to be honest. At the moment,
Okay.
it's just look after sort of your patients and look after the way we actually been taught for the last few weeks and few months.
Yes. Dr. Yusuf, you want to add something to that?
Yeah, just 3-4 things about the vaccine. First of all, please remember that there are 4 coronaviruses which already exist. They normally call common cold, and we do not have vaccine against any coronavirus. This time, it will be first ever in our history to actually make a vaccine against a coronavirus.
Mm-hmm.
Normally, to make a vaccine, you need significant amount of time, at least 2 to 3 years, to create the vaccine. There are 3 stages to actually make the vaccine before it can come for public use. At the moment, probably the best project in the world which is happening is between Oxford and another country, where they are on one hand rapidly researching the vaccine, at the same time they are mass producing the vaccine, which is a huge risk, because if the testing of vaccine does not come out to be effective, the whole mass production will be wasted. But that's the risk being taken for the sake of time management to get the vaccine here. And that will be, even with the best assumptions, will be about middle of next year.
Okay, thank you very much. And what about, there's another question is about the flu season, which is coming, and winter season coming up. And what is, do you reckon, an impact of flu season on the community? And that's a very valid question, because flu shots are available now. And if any of our viewers who haven't got the flu shots, please get the flu shots. That's my recommendation. And obviously our expert panels will elaborate on that.
About the flu shots, I mean, I have been working, I think over 21 winters I've been working here in Australia. This is the first winter when there's hardly anybody got influenza. You can imagine that if you take care of your hand washing and sort of keep a distance and no one is around you, you won't catch a normal influenza. So, I mean, we are in sort of stressing everyone that we should get vaccinated. All of us, we have had it. But looking at the community, hardly anyone is coughing. I mean, now probably even if someone wants to cough, they don't want to cough because they would be suspected that they're having COVID. So honestly, there is hardly anyone to influenza, which proves the point that is actually if you take care of your hygiene and you won't have even you won't have influenza.
Yes. And definitely, there are a lot of more questions, and on this, I will like to get back to Dr. Sabha. You were talking about social distancing and obviously everything, human-to-human touch. That is very important, and throughout our life, we've come across that touch is very important. Connection is very important. Now it's a new normal. How would you say? How would you see that in the new era now?
It's a beautiful question, Dr. Irfan, and हम साइकाइट्रिस्ट ना अपने पूरे वजूद को एक इंस्ट्रूमेंट की तरह यूज करते हैं. We don't have a stethoscope, we don't have an MRI. Our self, our hands, the tone of our voice, and the touch sometimes is how we create trust, how we convey empathy. I'm trying within social distancing because I believe in the wear your own oxygen mask first. So I'm careful. I don't want to get sick, and I think all of our medical colleagues should be very careful. But I try to do, like when I'm seeing patients, I am still seeing patients face to face because I work in a hospital. But my private patients, I'm seeing them all through telehealth. So I'm using my hands more. I lean in. I make more eye contact. I share my own anxiety where I can appropriately. That human common connection बहुत important होता है, Dr. Irfan. With the children, I'm sure Dr. Yusuf, Dr. Bashir का भी हमारा एक बड़ा अजीब हो गया है medical practitioners का कि हम घर आके सबसे पहले we rush to the bathroom now. We change, we shower, and then we expose ourselves to our family because some of us have vulnerable parents, some of us have young children. तो एक वो भी नया norm है. बच्चों के साथ, you can't rush home and get that hug from your child. But it's amazing how we all adapt. I very genuinely believe our new generations will not be shaking hands and hugging and touching as much as we all do. I think people adapt. इंसानियत का नाम ही evolution है. Human beings evolve. But I think there are many ways through your eyes, through your expressions, through the tone of your voice, you can still convey genuine. The key word here is genuine. If it comes from the heart, it is reflected in your eyes, in your tone. And if it's coming from a place of knowledge and a place of experience, patients are like children. And I don't say this with any disrespect. I have a lot of respect for my patients. लेकिन जिस तरह छोटे बच्चे होते हैं ना, वो इंसान की genuineness पहचान लेते हैं. मरीज भी डॉक्टर की genuineness पहचानते हैं. So I'm sure a lot of my colleagues would say that they're still able to engage with their patients. Not forgetting that the medical body has a huge amount of skill set. They know how to communicate. They know how to convey and generate trust.
Definitely. Definitely, you answered it really well. I'll add a few things here. First thing, I wanted to make an announcement that NSEP Victoria, in this, obviously, it's a very stressful time at the moment. NSEP Victoria has come forward and has organized a list of doctors and dentists who will provide free medical advice to those affected by COVID-19 pandemic, and that is encountering all the students who don't have access to Medicare, and also the families of international travelers who are families of Pakistani community who are here and who don't have access to medical care and Medicare. So NSEP Victoria has organized a list of doctors that is there, and dentists who can give you a consult, obviously, and the list is available. You can visit NSEP Victoria website as well. This recording, this live recording will be available on NSEP Victoria Facebook page and FM Pakistan Facebook page. And if you've got any questions, you can send it to admin of NZIP Victoria as well. There are a lot of questions that are coming through. We will try to make sure that we cover as much as we can, but because of the limited time, I think we'll have to bring up another session in which we can cover it more broadly. Before I go further, I would just like to share the website. There's a website, unitedleaders.com.au. It's a portal for COVID-19 for specific Pakistani community. It's unitedleaders.com.au, and you can get a lot of information about COVID-19 from there as well. We're running short of time. I would just get back to our presenters, and I would just get a last message, a question, anything you like to say to our audience who are doctors listening to us as well, and obviously who are there. So if you want to give Dr. Yusuf, starting off with you, if you want to give any message, any last message you want to give.
I'll just quick message for the community. As I mentioned earlier, the GPs are the experts in your health, and we are open for business. So access health. And for doctors, look after yourself. And Sabha has already mentioned, make sure you look after yourself to look after your patient better. Thank you.
Thank you. Thank you very much. Dr. Bashir, any message that you want to give to the community out there?
I would stress the same thing to because most of the audience, those listeners, they are doctors anyway. I would just tell them that all your life you have given to the community and to your patient. This is a time you can slightly be selfish. Selfish means that whenever you go and see the patients, just make sure you wear the proper PPEs, because if you are unwell, then who is going to replace you? Just protect yourself, particularly in this situation, so that you can look after as many as sick patients. So, and for the community, make sure, wash your hands, change your habits, be healthy, and we will be out of the wood, definitely, and inshallah.
Inshallah, definitely. We are getting a lot of questions, and because of the time constraint, we'll not be able to cover all the questions, but I would love to add more questions in future episodes. We are going to bring Dr. Sabha, any messages that you want to give, and then we'll take some comments, and then we'll wind up the show.
I think Dr. Yusuf ne or Dr. Bashir ne बहुत खूबसूरती से articulate किया है. The only thing I'll add is keep looking after your mental health after this pandemic is over. All things come to an end. We will see the end of this, inshallah, maybe in a few months, maybe in a few years. But remember to always look after your mental health and to look after the mental health of your family. And when you do that, you will automatically look after the mental health of your patients. And please, it is an equalizer. Don't be shy to get professional help. आप अपना हाथ बढ़ाते हैं तो we are always here. We are here to help. So please get help.
Definitely, and I reckon that is the time has is really gone really fast, and we were expecting we will cover a lot, but we have tried to cover most of it, but obviously there are still a lot and the Victoria Facebook page if you've got any questions related to COVID-19. If there's anything which is affecting you, as mentioned before, there is a helpline that is available. If you feel distressed or need any support of any of this information given in this broadcast, you're more than welcome to call Lifeline Crisis Support Suicide Prevention on 131114 and Beyond Blue on 1300-224636. It's a Lifeline and 131114 and Beyond Blue on 1300-224636. And I would like to really thank all of my guests, Dr. Yusuf, thank you very much, Dr. Bashir Kondar and Dr. Sabah Khalid. Thank you very much for joining me, and I'm sure our viewers must have really enjoyed it, and there's a lot to take message out of it, especially in terms of the mental health aspect of it, because I reckon any person who is listening to it has been touched by coronavirus as far as the mental health is concerned. And the life has changed, our normal has changed, and that's the way we have to live. And it's going to take a long time for us to get back to where we were. Thank you very much once again, and I wish you all the best. Stay safe, stay isolated, and NZIP Victoria will be bringing more broadcasts in the future for you. And if you've got any feedback, you're more than welcome to send us email or send your comments on admin to NZIP Victoria. Victoria Facebook page or email of NZ Victoria. Thank you very much, everyone. Take care of yourselves. Stay safe. Stay isolated. Allah Hafiz.
Thank you.
Assalamualaikum Pakistan.
FM 100.